Hi guys, welcome to the channel. Love the activity and the feedback that I'm getting in the past few weeks. Glad you like the content and I'll be keeping it up. Once again, welcome to my channel where I focus on celebrities, athletes, artists with medical scares, near deaths, and hospitalizations. I like gossip and entertainment, and meshing this with my medical career makes things spicy and fun. Enjoy! Let's jump into the video. If you haven't heard, Dean McDermott posted over the weekend on Instagram that he was hospitalized with fevers and chills. He's been in and out of the news for the wrong reasons, but his claim to fame was some crappy rated movies. He's a professionally trained chef, but most importantly married to Tori Spelling. Cheated on her, and if you were born when I was, Tori was an actress in the ever so popular show Beverly Hills 90210. Here is a clip from his Instagram talking about his symptoms and hospitalization stay. Obviously looking like crap, fatigued, and still posting. Gotta keep on posting for the fame, I guess.
Oh man, this sucks. I threw my back out 2 days ago, and I can't walk. I'm bedridden, and now I'm sick with a temperature of 102. Boo. I'm supposed to fly to Vancouver today to be with TT and Stella. That's not gonna happen for a couple days. I'm so bummed. Boo. I hate being sick and I hate not being able to move. I'm gonna be a crotchety old man for sure, because I hate this. I hate this so bad. So anybody who's out there who's sick this weekend, or has thrown out their back, or stubbed their toe, or whatever, who's hurting this weekend, I'm sending you some love. Send me some back. Get it? Send me some back. Ouch.
Based on my research, it appears Dean may have pneumonia and possibly meningitis. His 6-year-old son Finn was sick and gave it to his dad. If you guys want me to talk about pneumonia later down the road, comment and I'll make a dedicated video on this. In the meantime, I want to streamline this topic and focus on meningitis and what it's all about. What is meningitis? Meningitis means inflammation of the membranes, aka the meninges, surrounding your brain and spinal cord. The swelling can cause headaches, back pain, fever, and stiff neck, and usually the swelling is caused by some form of infection, a reactive disease, or potential virus. Here is a patient with active meningitis. Sorry for the Indian Hindi language as the background, but clearly a big component of meningitis is headaches and stiff neck. So much pain that it's causing you to cry, become delirious, have random arm and leg flinging, essentially uncontrollable movement. Another classic sign of meningitis is cranial nerves becoming dysfunctional. For example, look at the patient's eyes. Are they dilated, uneven, moving randomly? This video shows the concept of ping pong eyes and another concept called ocular nodding. Enjoy. Most of the time we have fancy imaging and tests to confirm the presence of meningitis. But what do you do when you don't have these available? Well, the test we do is called a Kernig sign. Here is a video explaining this. See how the patient's neck bends upward as the thigh is flexed, and then the neck relaxes back down as the leg comes down. This is classic for stiff meninges of the neck. What are the meninges? This is a thin film layer, but actually quite tough, that surrounds the brain and spinal cord. It acts as another layer of support so the brain and spinal cord do not move or get injured. When meningitis occurs, you have swelling of the meninges, and this swelling then impacts the spinal cord and brain. The swelling will also affect the outer surface of the brain, leading to change in mentation, confusion, delirium, and if worse, if the swelling is too severe, it can also cause coma and death. So this video walks you through what a lumbar puncture is. Essentially, the person lays in a sitting position with their spine bent forward, kind of like a cat leaning forward. What this does is it opens the spinal vertebrae so that the anesthesiologist or neurologist can advance a needle through the vertebrae. Usually it's done at the lumbar vertebrae between 3 and 4 and 4 and 5. What they do is they palpate the spinal vertebrae, and wherever they feel that like opening is where the insertion site can be done. Now obviously they take great care in preventing infection. Here you can see the doctor using betadine in a circular fashion to clean the skin, as you don't want to introduce infection, and then with a long, thin and thick gauge needle, this is advanced between the L3 L4 space. Here is a clear liquid fluid dropping out. This is the CSF fluid. High pressure can be an indicator of meningitis. Also, the milky fluid coming out of the CSF fluid can also be a sign of infection. Keep in mind that normal CSF fluid is like the consistency of water. So once again, you can use this as a means to get diagnostic data and try to figure out if there's an active infection. The fluid sample can be sent to a microbiologist where they can process for infection, and if the tubes or the CSF tubes look infected just on first glance, you can already start antibiotics. So that sums up what a lumbar puncture is. There's still a lot to cover, but I'll spare you the details. The main thing is Dean McDermott is being evaluated for this condition. This is what doctors do to assess this, and if suspecting the bacterial cause, IV antibiotics are administered. Sometimes seizures, confusion, delirium can occur during meningitis, and the worst case scenario, if severe life-threatening, can cause death. Hopefully Dean does well and can return safely to his family soon. Once again, thanks for watching the video. If you like this type of content where I make medical learning fun and interesting, give me a like. If you have your own questions, shoot me a comment and I'll talk about it in my next video. Videos post every Wednesday and Sunday. Click subscribe in the link below. Your feedback is valuable as I'm new to the YouTube world and want to grow the community, the channel, and help the world get educated regarding their health. Take care.